Well, the impact, I think, first of all, I think it's brought our family closer together because I'm much more involved in his care, and I've learned a lot about a lot of things. And frankly, I've seen things, parts of his personality come out that I've never seen before, and his just to watch his motivation, particularly working with the clinicians, he has just a wonderful relationship with them, and it's been just so encouraging to watch him because he surprises himself. He succeeds at things. His just his self-esteem is really remarkable considering where he used to be as a very successful electrical engineer, and suddenly we had to kind of start over again. And so we've watched our family work through this, and with the help of your team, and it's made a huge difference for us. Well, we had gone down the traditional speech therapy route, and it seemed that we were doing the same thing over and over again. And I'd already learned how to do most of the things that they were doing, and I just felt like we were spending money that wasn't really helping us much. So we thought we would try a little bit more of a non-traditional approach. And I had done some research about the clinic, and I talked to a couple of friends that were therapists that thought that this would be a better place for us because they're trying new things, they're trying to be innovative, and they really pay attention to the patient's needs and not just what seems logical, because I've seen so many of the clinicians do different things with different people, and we didn't have any idea what we needed. And that's one of the reasons why I found this to be an intriguing approach to accomplishing what we think we're accomplishing, because we are improving. And again, we just didn't want to be, we just weren't done trying, and we wanted to try new things. And Jeff is very motivated and very focused on getting better. And that's one of the reasons why we thought that if we took more of a non-traditional approach and coming into a more of an academic environment, to me there's opportunity to take more chances, to try new things, just to pay attention to doing things a little differently. I think that was one of the discouraging things to me initially when I saw the scope of the world that we entered after Jeff had his stroke was a totally different group of people in our life as far as therapists and people that we meet and groups that we've gone to and different experiences that we've had, that I saw so many people that got to a certain point and they just said, I got what I got, and that's it. Once the insurance stops paying or whatever, and it just was very disheartening to us, and we spent a lot of time talking about that. I said, we have to decide that we're going to commit to this and keep working at it.
Can you share a little bit about the students that have worked with you?
Yeah.
Has it been a positive experience to have the
Yes.
students?
Yes. Very perfect.
Perfect.
We had Jordana, who was delightful. She's got us started, and then we had Kara in the summer, and we had Amanda and Caitlin, and who else do we have? Dr. Whiteside, of course.
Yeah.
Right.
And they all brought such different things to. He had a nice relationship with all of them. The freshness of having someone new, every semester was really nice.
Thank you. Dr. Right side. I speak clearly.
You do speak clearly, and
Getting better every day.
that's right.
Every day, something different happens every single day. He does get better. So
Yeah.
thank you.
Thank you.